My name's Michael East, and I'm going to show you what the difference is between a simple ovarian cyst and a complex ovarian cyst. Some of you visiting this website will have been given a diagnosis that you have an ovarian cyst, so I'd like to demystify that for you. So if we draw this to represent an ovary, and we'll start off describing a simple cyst. First of all, each month you develop a cyst anyway, if you are ovulating, that is called a follicle. Now these get quite big, they get to 20 millimeters in diameter, and they house the developing egg. Eventually this pops and out comes the egg, and then that cyst just shrivels up and goes away. Sometimes they don't always go away. Sometimes they keep on getting bigger, and they typically get to 30 to 40 millimeters in diameter, and they tend to hang around for 2 or 3 months, so sometimes less than that. You may not even realize you have one. They may be found accidentally on an ultrasound scan that's performed for some other reason, or they may cause pain because they can cause the ovary to twist a little bit, and sometimes they can bleed into themselves, and that then often cause sudden pain. Invariably that pain settles with conservative management, and most women do not require an operation for this kind of cyst. We call it a simple cyst because it's simple in architecture. That is, it has a thin wall and there is absolutely no internal detail whatsoever, unless it's bled into itself, and it gets a little bit of complexity from that. When we're referring to complex cysts, we're still talking about architecture of the cyst. Does the cyst have walls within it, called septa? Does it have solid areas? Are parts of the wall thicker? Is there any free fluid, so-called free fluid in the pelvis, around the cyst? And does it have evidence of an increased blood supply? Each of those features that I've mentioned adds more complexity. The more complex a cyst, the more likely it is to be a tumour. It is to be remembered, however, that most tumours are benign.